Good afternoon, everyone. Very happy to be here. You will soon see why I'm so excited. My San Diego-based nephew is supposed to be in the crowd as well, so hi, Liav. So thank you for having us. And this is not going to be the typical presentation about deep learning and neural networks. And we're also not going to tell you about the journey of how hard it is to build the healthcare startups and why we're trying to climb to the top of the mountain. The reason is that we're already on the top of the mountain. It's called the AI hype mountain. So there we are at the very top. You see deep learning. We're right after IoT devices. Remember what those are? Very boring. We forgot all about them. And this is how AI and hype curves work. So in the next couple of years, you will be here coming to more Fortune Brainstorm sessions. You will hear about exoskeletons and smart dust, whatever that means. Well, we will be working in the trenches for pretty much the next 4 or 5 years to install our technology hospital by hospital, talking with the IT department of every hospital, HIPAA compliance, GDPR, FDA regulation, and all this boring work in the shadowed part of the hype curve. But before we say farewell and goodbye and be forgotten, we wanted to share with you a few cases that were sent to us by a few of our hospital collaborators, real cases that happened in the last few weeks. Obviously, the pictures are illustrated, but the hospital names and the cases are real. So let's call it the story of the 3 grandmothers, for lack of better words. So grandmother number 1 reached to Kfar Saba Hospital Meir with head trauma. They do a neurological examination. It turns out to be okay. The radiologist, after a night shift, very fatigued, decided that there is no evidence for an intracranial bleed, a brain bleed. Luckily, our system, already deployed there in a pilot mode, alerted the department head that this lady has a growing bleed in her brain. They called her in. She was about to leave the hospital. They treated her emergently, and everything is okay now. So this just to show that AI can already provide impact, saving patient lives by reducing misdiagnoses that are caused due to human fatigue. Case number 2, grandmother number 2, a bit older lady, came to a different hospital in Tel Aviv, Ichilov Center, with a specific request from the GP to check whether her lung is ruptured, whether she has what's called pneumothorax. Chest X-ray was conducted. The radiologist decided that there is no pneumothorax. There was a mild pulmonary edema. And because of the specific request of the GP, she was considered to go to a CT scan to check for the pneumothorax with all the waiting time, the extra radiation. Again, luckily, our system was there deployed in a pilot mode, alerted the department that pneumothorax was found within less than 1 minute on the chest X-ray. And in clinical trials we recently conducted, we saw that we can reduce more than 85% of the time it takes to see those acute conditions by the team. So this is yet another significant impact that AI is bringing right now in healthcare. And last case, all the way from Europe. I guess UK is still Europe, right? So this is the UK at Oxford University. Grandmother number 3 was sent to be checked for cancer. So a CT scan was conducted. Thankfully, they discovered she has no cancer. She was released back home. Over there, our system was deployed commercially after an extensive pilot period. And the system was checking for a unique thing, a vertebral fracture in the spine. Those vertebral fractures are the key indicator for a coming osteoporotic fracture. And they are often missed by radiologists who are very tired, very overwhelmed, and looking for the cancer. The system found a vertebral fracture. The nurses, admins that are activating the National Fracture Prevention Program called the patient in. She was very grateful that they showed her the fracture and that she's going to be treated to prevent an osteoporotic fracture. She's one of the 100 patients that were already treated since the beginning of the year due to the results of this algorithm. And just for the Oxfordshire Trust, the NHS benefit will amount to more than £3.3 million in the next 5 years just from this algorithm and from prevention of osteoporotic fractures. So the Geisingers and the Kaisers in the crowd, talk to me later. You have similar systems as well. So here we are saying farewell and goodbye before we are moving to the shadowed part of the hype curve. And stay tuned for more news from us. And thank you very much for having us here.